rock with us.
Dazzling, dilated, display a new sound.
We all live on stage.
Run up in the venue like what?
Check it out, check it out. You're now rocking with the best.
Dazzling, dilated, display a new sound.
We all live on stage, and we do it for you. Yeah, we do it for you. Come on, we do it for you.
Live on stage.
What's up, guys? This is Sam. Got my main man Richard here
What's up,
from
guys?
Brockport again.
Mm-hmm.
We haven't done a video in a long time, but we're here. So, just gonna pretty much give you an update on how are things going with us for college. So, go ahead, Richard.
Well, SUNY Brockport just came back for Thanksgiving, everything. Hope everything's fine with you guys at home. But, yeah, school's all right. School's not bad. I'm applying for the nursing program actually this semester. It's my sophomore year, and I've taken all my prereqs like anatomy, microbiology, chemistry, and all that. I'm doing okay in some of them and stuff like that. But, yeah, I applied for this semester, and then hopefully if I get in, and the next...
You're gonna get it, man. You're gonna get it.
I know, I'm praying, man, but, if I get in, I'll start next semester. Actually, not semester, next semester. Next year. I'll start next year.
Next fall?
Yeah, next fall.
Oh, okay.
I'll start next fall, and then I'll have 2 years, and then I'll be able to get my bachelor's.
Wait, you're gonna apply in spring semester?
I'm applying
Wait,
this
applying
semester
this
right
semester?
now. Yeah, I'm applying
Why does it take more than a semester?
because it's every fall semester the program starts.
I got
So I apply in the fall of this
Mhm.
semester. Then I find out in the spring
Oh, okay,
during
okay,
March,
okay.
and then after that, the following fall is when I actually start the program if I
Okay.
get in. So just pray for me, guys.
Mhm. Alright, so that's cool. For me, I'm in CSI, College of Staten Island, and you guys probably heard in another video, I got into the program, so I was really happy about that. We've been doing a lot of things like clinicals, like once a week only, really. Clinicals once a week, we have lab once a week, then we have lecture once a week. So, learning so much information, because it's a different transition for me because he hasn't started his program yet.
Yeah.
From Curtis, how our questions were oriented towards what the LPN does. Now I'm doing, fundamentals of nursing. Now the questions are oriented towards what the RN does.
So it's a role switch.
Exactly, totally different role switch. So even though we have a good, background foundation information, it's totally different because now we're the potential RNs who have to deal with the situation at hand. So it's really cool. What else? I'm taking a medical dosage class, fundamentals of nursing, and that's pretty much it. Next semester would be like part 2 of fundamentals of nursing, which it's probably gonna be like med surg, right? So that's pretty much how things are. Finals are winding down in like a few weeks, right?
Mhm.
And finally school will be over because I'm tired of school.
Wait. So when you're along with your nursing class that you're taking right now, are you taking any like anatomy or microbiology or stuff like that?
No, just pretty much medical dosage. Next semester, I'm gonna take the second part of anatomy and physiology.
Mm-hmm.
So it'll be pretty good. My next semester nursing class is 9 credits, so that's crazy. That's my teacher said that's like where the foundation. No, not the foundation. Where most of the NCLEX information is next semester. So
Oh, okay, that's good.
it's a lot of stuff.
That's good.
So we came up with something like an idea to share why we did nursing. We thought that would be a good idea to share with you guys.
Yeah. So
You can go first.
like, I don't know. In the beginning, I had just applied to the program just to do the program because at first,
At Curtis, right?
because at first when I was in like middle school, I was all computer savvy and stuff. I was like, oh, maybe I want to work with computers and stuff like that. But then I was like, if I don't get into like a specialized high school, or whatever, let me do the nursing program at Curtis.
I forgot about that. I wanted to get into the specialized high
Yeah,
school.
but like who knows? I probably wouldn't have been able. I probably wouldn't have done. I don't even know what I would do right now if I was still in specialized high school. But I applied. So Curtis was my second choice actually. So literally, like besides besides specialized high school,
Mhm.
Curtis is my first choice.
It was Staten Island Tech, right?
Yeah, either Staten Island Tech or whatever, room tech, blah blah blah. But
Yeah.
that didn't work out. So Curtis was my second choice for the nursing program and stuff. And I mainly got the influence from my parents. Well, not my parents. Well, my dad is an accountant, but my mom went to nursing school. My aunt, when I was growing up, I used to go with her to the hospital because she used to work in the hospital and stuff. She went to nursing school, and they were like, "Oh, Richard, you should become a doctor." Blah blah blah. So I was like, "Hey, if want to become a doctor, why not start, foundations with like, a medical foundation starting, here or whatever."
Yeah.
So when I didn't get into the specialized high school, I went to Curtis and stuff. First 2 years is like, wherever took regular classes. Actually, the second year was when you took the,
This is a regular systems class.
Yeah, you took your regular, they taught you like regular, like beginning
System.
fundamentals.
Isn't
and
it
stuff
good
like
that we didn't get into the specialized high school?
I would have been.
It's crazy how it all worked out. Yeah.
I would have been LPN right now
yeah.
if I didn't get into
That's
the specialized.
I'm really happy we actually didn't, because I mean, it was like when you're in high school, that was like the hype. No, when we were in middle school, that was the hype. Like if you get into a specialized high school, it's like you're like better than everybody. But it's like that wasn't the
Granted, like some schools look at you.
I guess
like
yeah.
psychologists or whatever will look at you, but at the same time, if you do good in high school,
exactly.
it's still you're doing good in high school.
You can
so
go into any college.
Yeah, you should be fine. Any college will look at you well,
whether you go to specialized high school or not.
So with that, I went to Curtis. I actually got into the Curtis, and then I didn't even know like it was a program that you actually had to like apply for and stuff like that until I actually had to apply for, and I found out I got in the LPN program. I didn't even know there was two programs.
Mm-hmm.
I thought it was just one nursing program once you graduate, blah blah blah. I didn't even know you were gonna go to the hospital. I thought you were just learning about it.
Yeah.
So for me to go through all of this and stuff, and then find out, hey, I'm in the LPN program. You can get out of high school and probably get like a job working at $25 an hour and stuff. I was like, what?
Yeah.
So, I went through with it and everything, and then for college, I was like, instead of going to like doing biology or whatever, why not major in something I'm already done through high school? I've already done nursing throughout high school, so why not just continue that with college and make it easier for myself?
Exactly.
And that's where I am now.
Mm-hmm. All
So.
right. That's pretty cool.
Mm-hmm.
For me, my sister, I think my mom was in there first, and I guess most of the is it the push, or is that the right word?
Drive?
Yeah, most of the drive, I guess, came from them. They knew like this program is pretty good, that you can come out of it with a job, like a $24 an hour job, pretty much in our area, Staten Island. So to come out of high school with a license in your hand is something like crazy. It's like special. So to be able to first of all get into the program, to actually graduate and pass your NCLEX, it's like you're like the cream of the crop. It's like you actually made it. Like people in high school, they don't get to say yeah, exactly. They don't get to say that something like that. Like it was prestigious. That's what pretty much put me there. Put me in Curtis. I was gonna go to McKee High School, which is close to that school. I guess I'm glad I didn't go there. I don't know. I wanted to do engineering there. So paths switched. As I was in middle school. So I ended up going there. I met a lot of people in Curtis that I'll never regret it, right? People like people like
it's been since elementary. So.
Yeah, crazy since elementary.
But it's basically like the same thing. We both like just thought we were gonna do like something that had to do with either like engineering or computers or something like that, and then came to Curtis, and there you go. Just straight nursing.
Yeah, and it just
guided us.
It totally switched on me. I'm glad it's nursing now. You're gonna try to say. I mean, I'm not saying I'm glad it wasn't engineering, but it's almost like now I can see like the passion and what I want to do, because my passion is really like to teach. You gonna try to say. So if I could do something around that with nursing, whether it's be like a clinical teacher or a lecture teacher, like that would be like my goal in the future, to do that, to teach like people, because I find it very like not easy but
rewarding.
Exactly. Very rewarding, very very fun. And our high school senior teacher, he had a different teacher, but he heard about my teacher, and obviously both teachers are great. Just the fact to put someone through a program and to give them the tools of success and to pass and to be a better nurse or any profession. You know, to have that teacher who helps you from the beginning to the end or whatever is very rewarding for them. And I always thought I wanted to have that same feeling. So to be a nurse, I'm not saying you can't do that. I couldn't do that with engineering, but I'm glad I went onto that path of nursing. You could help a multitude of people.
And the discipline factor definitely plays a role when you're in nursing school, because you have to be very disciplined and very, you know, patient and be able to multitask at the same time. Like, all of this stuff we were able to learn. These are all like skills you would probably need to know in college. Granted, if we didn't go to granted, if we were in the nursing program, we probably wouldn't have learned most of these things already that we've seen. Like, now when we go, now that I've gone to college and everything, I'm at school, SUNY Brockport, all this stuff, all these things on like the body functions and everything and stuff. I already know that, and you know, all these study skills that I already learned it from high school. So it's just basically a bring on. Granted, you know, it's a college level, but if you've learned how to, once you've learned something like from high school, and it's basically, all you have to do is just basically adjust it when you get to college, and then you should be fine. So, but it's just basically just the same thing. You know, as long as you study in college, it's just you actually pay for your classes, so you actually want to have to do good in them. But as long as you take the same work ethic that you had, especially since we were in nursing, you know, you have to do everything on your own. If you want something to be done, you have done right. You have to do it yourself, regardless of whatever it is. You know, you just have to make sure that you get it done, and that's basically how it is.
Yeah, and I definitely want, if I could give a shout out to my teachers or our nursing director in Curtis. You know, people. I'm pretty sure in the future, I'm already predicting it, right? You know, there's gonna be people who are gonna go to Curtis or who are in the program. They're probably gonna see this video. Just to give a shout out to them, the amount of, you know, just the determination in their hearts to make us succeed, you know, to make us better nurses. You know, you always have those bunch of people where you just don't know, like, is this person serious enough? Can they pass this test? And I feel like I was probably one of those people. Like, one of my senior teachers, she was just confused. She didn't know, am I putting in the work? Am I doing anything to pass the test? And I did, you know, with a lot of, you know, other side, you know, activities, you know,
like it was great.
Just to give a shout out, like, thank you, you know, they really made the difference.
They're hard for a reason.
Exactly.
It's just
that's why
it's just to prepare you for what you're about to do. So
yeah. Do you want to talk about why nursing schools are? Do you want to like talk about we already talked about experience.
Yeah, but like
Curtis.
But
let's give them like just an idea, especially anybody who might enter the Curtis nursing program
or just any nursing
or any nursing school
in general.
For anybody out there. I'll just give my little like synopsis. You know, I've watched so much YouTube videos. Because that's what I like to do, like, on my spare time. I like to watch a lot of nursing videos. Videos like life of an RN, life of an LPN. What do they have to do? You know, like their typical day. But the reason why, you know, it's so hard is, the nurses, you know, they're almost pretty much like 90% of the time they're with the patient. You know what I'm trying to say? It's direct care, you know? You can't not, you know, look at your patient and assess, you know, what the problem is. That's really what the nurse does. And they bombard you with all this knowledge, and, you know, they want you to know it. That's especially in nursing school. They don't want you to just get 90s. Anybody who's out there who's an A student and maybe enters into nursing school, now they turn into a B, sort of C/student, that's not bad. Right? They always say that. I always watch videos on this, and not to just be like, oh, let me just lay back and let me just pass nursing school by the skin of my teeth, or the, you know, whatever. It's, if you know the information, if you know how to apply it in the clinical setting, that's the most important.
That's all I'm telling you.
Pretty
like,
much, right?
You being in nursing school, once you get into the I'm not in the program yet, so that's why, you know, it's all about, you know, getting A's and whatever.
Exactly.
They just want to. That's what they want to
just. They want to look at you.
Yeah, they all want to just weed you out. That's why I'm taking all these prereqs or whatever now, so that way they can weed out, you know, the people that are serious and the people that are just like whatever. And once you get in the program, like, I know you've heard that saying about whatever. I don't know if you heard it, like, C's get degrees and stuff like that. But like that's
Especially
not. It's not the
yeah.
point. Like you don't have to stress about you getting an A.
Exactly.
All they care about is you knowing the material, you
Exactly.
being strict about everything that you learn and applying it in the
In the
correct
clinical settings. Exactly.
clinical setting. Because all in all, when you actually start working in the hospital, it's gonna be a totally different story. If you don't have the grasp these things by now, like that's why sometimes I feel bad for like people. I mean, I don't feel bad, but it's like people that are like like photo like people that like see stuff that can oh my gosh
like
photogenic memory.
I got you.
Like they just see stuff whatever and then they just memorize like that.
Oh,
and
they're
then
able to
done.
just like do really good on tests.
Yeah, they just
okay.
like some people that are just me. I can't do good on tests, but when I focus
Yeah, me
on
and him
studying,
are like we're weird test takers. Yeah.
when I focus on studying, I focus on studying just so I can understand it. Because when I
Understand why,
understand it, that's when I can actually retain it better and I can
And apply
actually
it on a
apply
test.
it during an actual, not even just during a test. Like let's any situation came up, I could be like, oh, this and this happens, so whatever
Exactly.
I know what exactly.
This is gonna
what
be
to
the
do.
plan of care or the plan of treatment.
Because in nursing school, it's all like it's just strict protocol. It's all strict protocol because when you actually start working, all these things are gonna happen. You're gonna have to learn how to multitask and do separate things at the same time and try not to forget a lot of things because when you're a nurse, you're gonna have to do not to do just one patient that you do in nursing school. Nursing school, they give you one patient and they give you all the stuff so that you have to do with one patient. So that way, you know how to do that with one patient. And then when you're actually working as a nurse, you're gonna have to know how to do that with 1, 2, 3, 4, 5. Who knows how
6
many
patients,
patients
exactly.
on an 8 between an 8 and a 12-hour shift. So that's mainly the reason why they're so hard on you. Make sure you follow procedures. Make sure you know clinical procedures. Make sure you know what to wear, what to do, what not to do. All that. Know that when you have to take nursing initiative or when you have to call the doctor or anything. That's the reason why they have all this bombarded into you now, and that's why
that's what we're gonna transition
strict
into.
about it.
Like the nurses in the job description. Like I'm not working. I might work soon, maybe as an LPN. Hoping for that. But just us thinking about it, we know like almost what to expect. It's what they have to do is just it's so much work. We're not saying they do all the work because you can't do all the work without the help of a whole interdisciplinary team. You know what I say? The job description of a nurse, all this information, look at nursing school as, like a great place and also a bad place because, there's so much information and work, but they're putting you in a situation. Don't focus on, oh, I need to get a 90. I need to get an A on this test. That's not important. You know what I'm trying to say? You still have those smart kids who pass nursing school with 75s, and they're one of the smartest people.
They become one of the best nurses because they know exactly what they have to do.
We're not generalizing. We're just saying, there's a majority of those people who get 75s and they really are intelligent people. They just maybe can't put it on
paper.
Exactly.
Yeah.
But I mean, that's what you're gonna have to do for the NCLEX. You gotta figure it out. You gotta be a good tester, obviously, to pass.
But all in all, it's just gonna be like how you. It's mainly just based on like how you perform. If like nursing teachers, sometimes they see. Nursing teachers, I'm telling you, they're probably the most hardest, but they know when somebody's working and when somebody's just, just doing it just so they have to do it.
Exactly.
Like I know, like some when we were in Curtis or whatever, like some of the teachers would just be able to point out, some if students are just actually trying, actually studying, actually doing everything they're supposed to do and stuff, and when students are just like using other people to do, oh, let me get this answer, let me get this, so I could just pass.
Because it's important when you're in the real world.
When they pointing you out something, oh, hey, during this and this procedure, what's gonna happen? Oh, they point to you and it's like, oh, I don't know. And then like you're just sitting there quiet. Exactly. Meanwhile, another person that's probably doing worse, probably a person doing worse than you, that's like actually trying, and they can actually know what to do. It's just that they can't put it on a piece of paper. You can pass a test, but they'll actually save a person's life, unlike you, which is the reason why teachers are so hard. Nursing teachers especially are so hard because one thing you mess up and then. It's not like it's just any other profession, like, being a mathematician or anything. Yeah. You're dealing with people's lives. Exactly. One thing that you mess up on or forget now can probably end up killing the person or making their condition even worse later. So that's
and we're not trying to say we're perfect. Definitely not. You know what I'm trying to say? We're regular human beings. We're prone to mistakes, all that kind of thing. But how me and like Richard just like to look at the situation from high school and now is, you know, you can work on these things now. You can hone in on your skills now. You can take this seriously. You know, get into the program. You know, pass the program. Do really good on your test. You know, you could take it serious now because when you get into the real world, no one's gonna be behind your back saying, "Oh, you gotta do this. Oh, you gotta do that." You know what I'm trying
It's all
to say?
gonna be
You
on
need to
you.
know that. You know what I'm trying to say? You're gonna be the patient advocate. You're gonna be the person who needs to take initiative sometimes, and either you're gonna help the patient or you're just gonna be like, "Oh, I don't know."
And this is literally all in this job description of a nurse. You got to be able to do multitask. You got to be able to not forget things. You got to be able to take care of many patients, or you got to be able to have patience. Patience is definitely something you're gonna have when you're a nurse. You know, doing everything at the same time,
Yeah.
having to do some of the things that might have to come up out of nowhere. Like you just have to be, you get used to that. So it's a good way. It's a good foundation if you start, you know, acquiring all these skills now.
All the knowledge and everything.
You
now.
know,
Yeah.
I mean, me, I haven't even gotten in the program yet, and I
You
know
already
that's gonna
read it,
be
exactly. You know
it's
what to
already
expect.
gonna be, and like, even though like I've been through LPN school through high school and stuff like that,
Yeah.
it's a totally different thing when you're an RN because roles change and stuff like that. So now instead of me reporting under an RN, I'm gonna be the
You're gonna
RN.
be the RN.
So it's like I have to know how to do this, when to do this, and everything and stuff like that. So, you know, it's just, I mean, I can't say that I'm ready, but you know, I definitely,
If you feel like you're ready to take on, you know, the role or whatever.
yeah.
And I also want to say that, you know, a lot of things they don't really teach you in nursing school is, you know, the stress management. You know, they really teach you, you know, the basics obviously now, and you learn more and more knowledge. But when you're on the job, you're on the floor, they don't teach you how to multitask, talking to the patient's family. You're calling the doctor, trying to order this. You're calling this. They don't really teach you that, and that's something we have to learn on our own, or that's something you're gonna have to experience out there in clinical, or try and get as much experience on it.
It's
You know,
very,
what do you want to say on that?
it's a very stressful thing. It comes with being a nurse. This is why sometimes I want to say that that nurses even have it harder than doctors, because when doctors, the definition of a doctor is is a person that has to deal with curing the illness or disease of a person. Now the nurse has to take care of the patient holistically, physically, mentally, and spiritually.
Yeah, you know, throughout the whole process.
Yeah, throughout the whole process.
Exactly.
So, in the beginning, it's not the doctor that checks in the patient; it's the nurse that checks in the patient. It's the nurse that checks in on the patient every now and then, not the doctor. The doctor comes in, tells the patient
You know, they do
what
rounds
they
and-
have. Actually, the nurse is the one who's supposed to check the vital signs and everything of the patient, then give it to the doctor, so that way he can determine what the illness is. The doctor comes in, tells you what the illness is. See you in 2 weeks.
You know, he'll probably, you know, reassess
Exactly.
the situation.
Reassess
again,
the situation,
you know.
and at a later date, then he'll leave. The nurse will be the one that will have to discharge you. The nurse will be the one that will have to tell you, explain to you all the protocol.
Patient
The
teaching.
doctor will be the one to tell the nurse, explain to the patient, you know, all the protocol and everything, how to take these medications and stuff like that. And you know, it's like you got to do all these things. You got to know all these things. You got to know how to do all these things as a nurse. And sometimes, you know, that's why, like, my instructor told us to me from the beginning, and I always said that, you know, why you always have to, you know, why patients always, you know, come with cookies and everything and stuff and feel appreciated by the nurse rather than the
definitely
doctor,
rewarded.
because it's the nurse that cares and takes care of everything that the patient has.
Exactly, and we're not like blowing up the spot like, oh, if you're gonna become a doctor, you know, that's horrible. That's, you know, that's definitely not what we're saying. You know, we're just saying, you know, it's in the nurse's job description. She's there with the patient most of the time. You get what I'm trying to say? They're getting their orders, you know, their everything from the doctor, and they have to actually implement it. You know, without the nurse actually doing, you know, the order or give the medication,
It would be a lot harder for you to be a doctor too.
Totally different. Exactly.
So-
Now the doctor has to do that. You know what I'm trying to say? So it's just a different, you know, roles and the jobs of what they have to do.
Not so, yeah.
But-
We're not trying to bash. I'm not trying to bash on doctors or
Exactly.
anything. I'm just saying that nurses have to do just as much work, if not maybe even a little more than the doctors
Exactly.
themselves. Like doctors, they have to go through a lot of stuff, medical school and everything. They have to because if anything happens, it's usually not on the doctor. It's on the nurse, but it can go towards the doctor as well. So if the nurse has to be on point, if the nurse is on point, and if the nurse is on point and the doctor's not, as long as the nurse is on point and everything can get everything under control, then that's it.
Giving medication, all that.
Doctors are really important, but nurses are just as important.
Exactly, just as important.
So
that's a great way to look at it. Anything else?
I mean, that's pretty much it.
Pretty much it, right?
Pretty much it.
Until next video, we'll probably talk about something else.
Hopefully the next time you see me, I'll be in the program.
Definitely.
But until then, just take it easy. If you have any questions, concerns, or comments,
Definitely.
you could just comment on the video below.
Comment, subscribe, share this video, show people. We're trying to be big on YouTube. I don't know about you guys, right?
mean,
can you help us? But really, like if we're able to help any other people. There's a lot of people YouTube channels that I love, like Nurse Nicole, all these kind of great channels. Nurse Mendoza. There's a lot of great people out there. We want to be another different YouTube.
We're just spreading the message.
That we can
just spread the message to nurses
about nurses and whatever. All right. So adios, guys.
Take it easy.
Like what?
Check it out, check it out. You're now rocking with the best.